Good morning, everyone, and welcome to today's webinar. This is brought to you by the Global Alliance on War, Conflict, and Health. My name is Hannah Wild. I'm delighted to be joined by colleagues from the Alliance, as well as our panelists from MedGlobal. Today, our webinar focuses on MedGlobal's experience responding to the humanitarian crisis created by the war in Ukraine. Before we begin, we'll have a few brief remarks by Dr. Hagopian on the Alliance itself.
Thank you so much, Hannah, and thank you for being our moderator today. So welcome to this wonderful audience on behalf of the Global Alliance on War, Conflict, and Health. This organization launched with a webinar sort of like this about a year ago, and we now have more than 100 member organizations from academia, humanitarian organizations, and journals. We also have a website, and individuals can join the organization at that website. You'll find it easily. This is the second in a webinar series that we're hosting, and we hope that we'll see you all on July 20th for the third in this series. It'll be a fascinating presentation on the relationship between war and the movies, including an interactive exercise with the scholar presenter Annie Cheney. We look forward to creating working groups on our platform as well, so stay tuned for some invitations for that. I'd like to thank 4 people who made this webinar possible, in addition to the participants themselves. Becky Brown with Southampton University, Alsara Badri with Stephanie Endo, an MPH student at George Washington University who has staffed this whole project, and Samer Jabour with American University of Beirut, our founder. So with that, I'd like to turn it over to Hannah Wild. Dr. Wild is a surgery resident physician at the University of Washington, where I work, with clinical interests in trauma and critical care, and with a focus on humanitarian surgical care in conflict. After graduating from Harvard with an undergraduate degree in comparative literature of all things, she did a fieldwork fellowship with nomadic pastoralists on the Ethiopia-South Sudan border. As a medical student at Stanford, she developed a methodology for including nomadic groups in health campaigns and contributed analysis on regional drivers of conflict that has been cited by policymakers, including the United Nations. Thank you for being our moderator today, Hannah.
Thank you for the kind intro, Amy. So with that, we'll begin. Since the Russian invasion of Ukraine on February 24th of 2022, it's estimated that there have been nearly 23,000 civilian casualties in the country, consisting of 8,450 killed, as well as over 14,000 injured. And these are very unlikely to reflect the true tally, nor do they reflect the millions of internally displaced persons and refugees caused by the conflict, let alone the far-reaching indirect consequences of war. Today, we have MedGlobal representing one NGO's perspective on responding to the needs of the population affected by this crisis. We welcome active engagement from the audience, but before we begin, a few administrative notes. Next slide, please, Steph. Here's a brief agenda, which we will try to adhere to make sure that we have enough time for each of our speakers, as well as all of your questions. We'll be triaging them actively in the Q&A, but we'll address them at the end. So first of all, this session is being recorded. It will be shared in the coming days on the Alliance website. To interact with our panel, please use the Q&A and chat functions. You can find those in the toolbar of the Zoom screen. And if you have any technical issues, please also feel free to let us know in the chat. Members of the Alliance team will be keeping an eye on that throughout the session. Please do place your questions there. We have dedicated time allotted at the end of our session, but if we do not have time for all of your questions, we will try to review them at the end of the session and get back to you with written responses to accompany the recording. This is Ms. Alexandra Kozlovska. She joined MedGlobal team as the Ukraine country representative in March 2023. Prior to that, she had over 9 years of experience in management positions with Ukrainian state authorities. Ms. Kozlovska has 2 master's degrees in international law and administration and was director of international cooperation departments in the Ministry of Health of Ukraine, the Ministry of Energy and Coal Industry of Ukraine, as well as the Ministry of Energy and Environmental Protection. Since February 24th, when the Russian full-scale invasion began, Ms. Kozlovska coordinated all the humanitarian medical aid for Ukraine, took part in the damage assessment process, was responsible for intergovernmental relations in the healthcare sector, as well as representing Ukraine in the EU4Health program. So with that, welcome, Alexandra. Thank you so much for sharing your experience.
Thank you very much, Hannah. Hello, everyone. It's a great pleasure to me to take part in this webinar. And my presentation will be today about war impact on Ukrainian health system. Next slide, please. Here you could see only just figures. What are the impact of Russian aggression on the healthcare facilities in Ukraine? You see that more than 1,500 of healthcare infrastructure facilities were damaged, and near 1,000 was completely destroyed and cannot be restored. Also, near 600 pharmacies destroyed and damaged. The most affected regions are Kyiv, Chernihiv, Donetsk, Mykolaiv, and Kharkiv Oblast. And as you know, at the beginning of the war, Kyiv region and also capital of Ukraine, Kyiv, was occupied by Russian troops. Healthcare facilities became a lot of time just goal for their missiles. Next slide, please. Here you can see its photos of healthcare facilities which were destroyed by Russian aggressors. Next slide, please. If we speak about damages that Russian aggression caused to Ukrainian healthcare system, that we see that it's near $2.5 billion US. Its estimated cost of destroyed and damaged health infrastructure. And unfortunately, Ukrainian government now couldn't assess damages on the territories that now are temporarily under not under government control and under Russia's control. And as I already mentioned, the most affected regions were Donetsk region, Kharkiv region, and also Chernihiv region. Next slide, please. And if we speak about all needs in Ukrainian healthcare system that was affected by Russian aggression, all the needs, it's more than $16 billion. And the main goals of Ukrainian government is reconstruction and recovery of damaged facilities and also creating new infrastructure. The most focused areas are rehabilitation, mental health, access to primary care, and also health emergency preparedness and response. And according to a World Bank there are near 500 million urgently needed this year as investments to provide qualified medical services delivery to Ukrainian people, to IDPs, and for healthcare facilities reconstruction. Next slide, please. And here you can see that need for rehabilitation increased 2 times, and also needs for burden increased for 1.5 times. And also it was affected by Russian aggression, and there are a lot of injured people that need this kind of medical services. Next slide, please. What is extremely important, according to the assessments of Ukrainian government, it's strengthening of personal resources of the healthcare system. What does it mean? That they would like to strengthen network of medical universities and colleges, also simulation medicine centers. Also, they would like to strengthen system of continuous professional development, and also planning of human resource needs of the healthcare system. Next slide, please. And we, as MedGlobal, we take part in this part of Ukrainian healthcare strategy, government strategy. Since March 2022, MedGlobal came to Ukraine to help IDPs, to help Ukrainian people, and also to help Ukrainian healthcare facilities. By the way, 2 of 6 listed needs that was identified by Ukrainian government and that I showed in my last slide, we covered as MedGlobal already 2. If we speak about simulation centers, we supported with medical trainings on POCUS and war polytrauma surgery skills simulation center of Chernobyl Medical University, and as a result, POCUS was included into simulation training curricula for 4-5-year students. Also, we help the Ukrainian government to strengthen continuous professional development. Since 2022, MedGlobal conducted 9 resilience medical missions, and we organized 79 training on POCUS, war polytrauma surgery skills, chemical weapons agents, triage, BLS, STB, also perioperative patient care, mental health. We trained about 1,400 physicians and nurses from more than 100 hospitals of 16 regions of Ukraine. As a part of the continuous development system trainers of Chernobyl Medical University, we trained 40 emergency doctors from 14 regions of Ukraine on POCUS. Also, in November 2022, MedGlobal supported Lviv College of Postgraduate Studies and trained near 100 nurses. And in this year, in 2023, we continue our activities regarding training and strengthening of medical education here in Ukraine, and also to increase practical skills for Ukrainian doctors and for Ukrainian nurses. And today, and also other speakers will provide more detailed information about our trainings in Ukraine. Thank you very much for your attention, and feel free to text questions in the chat. I will be glad to answer them. Thank you.
Thank you so much, Ms. Kozlovska. Because we're actually doing all right on time, I'd like to bring participants' attention to the fact that it is the Q&A box, not the chat function, that's enabled for us to be able to see and review your questions. We do have one from a participant, which is, what is the scale of primary care coverage now compared to before the war? I wonder if any of our panelists, Alexandra, if you'd be able to address that question at all. Otherwise, we can review that with other questions at the end of the session.
I can actually answer that question if that's all right.
Please.
Hi, this is Dr. Tanya Bucherka. I just returned from my 5th mission trip with MedGlobal 2 days ago. So primary care is what everybody is lacking now. Because there's so many internally displaced people, they don't even know where to start. So definitely a lot of people are not receiving the proper care that they should. And there are a lot of NGOs operating, but it's not anywhere the scale that it needs to be.
Thank you. I'd also like to bring everyone's attention to a recent commentary in The Lancet. It was put out by Paul Spiegel and several Ukrainian colleagues whose names I apologize I don't have on the tip of my tongue. Commenting on some of the indirect effects and long-term health consequences of the war, as opposed to the direct consequences on which much of our conversation centers. With that, I'd like to go ahead and introduce our next speaker, Dr. Maya Bizri. Dr. Bizri has a background in public health and joined MedGlobal in November of 2022. Her interest in global mental health, particularly in addressing the mental health needs of healthcare workers, developed after working in disaster and low-resource settings in Beirut in 2019. Recently, as part of MedGlobal's expanding work, Dr. Bizri conducted a trauma-informed care training in Ukraine for healthcare workers, focused on addressing burnout, secondary traumatic stress, and management of patients exposed to trauma. Welcome, Dr. Bizri. Thank you for sharing your experience.
Hi, everyone. Thank you for inviting me. Thank you, Alexandra, for the presentation. Can you all see my screen? As the introduction said, I joined Med Global as a Med Global mental health consultant, and I will be presenting the pilot project that we did in Lviv earlier, 2 months ago now in March. This actually, the picture that you guys are seeing are from the hospital we were in. So it was, these are bunker beds. It was a pediatric oncology hospital. And so I took this picture. This used to be a pool before the full-fledged invasion started. So I'll start, and please feel free to interrupt me at any point. It's more of an informal talk. I wanted to present first the mental health background in Ukraine before the full-fledged scale war started. So there was a higher, to start with, there was a higher, I mean, a mental health crisis has been looming for years. So if you look at in 2019, there were really efforts to change the mental health scene in Ukraine in collaboration with the WHO and the Ministry of Health. A survey that was done at the time showed that there was a higher prevalence of depression and alcohol use disorder compared to neighboring countries, with at baseline suicide rates triple the global average, which I think is important to note. And it was estimated around that time that 30% of the adult population had been facing a mental health struggle. And after a decade of I call it the 10 years ago, right? There was specific focus in the studies and in the literature about the mental health of the internally displaced Ukrainians. So it was estimated that not only did they have higher rates of depression and anxiety, but also that PTSD was at almost at 30%. So it was quite high. And to give you an idea of the mental health system in place, there was a fragmented psychiatric care. There were reforms, but there had been poor implementation of the reforms before then. And a year actually, sorry, I wanted to move my slides. Okay. And so a year before, so in 2019, the Ministry of Health with WHO had launched community mental health teams that will go on to improve access to care in different regions in Ukraine. And that had been really damaged. So with the conflicts, that had really been affected because of the logistical challenges. Their offices had been destroyed, the roads had been blocked. There was a problem globally, I mean, in Ukraine, all over Ukraine at the level of the supply chain. And so there was difficulty really continuing reforms that had been just started. The psychosocial scene had really been dependent mostly on international aid and humanitarian and NGO at the onset of the conflict. And on average, you want to estimate that in any conflict afflicted population, around 22% will carry a burden of mental health disorders. That's around 9 million or up to 10 million people. That's the estimates of the WHO for Ukraine, among whom around 4 million will have severe mental illness. And we're talking about mental illness that will require a psychiatric intervention. A specific population that is usually not very looked at in these settings are the healthcare workers themselves as a population at risk. Usually there was the literature increased around the pandemic, around the burnout of physicians and nurses and medics, but also in veterans coming back from, so in soldiers, in combat soldiers, but not necessarily in healthcare workers that work in combat settings. And the very small literature that is present obviously says there's a much higher risk of PTSD and depression that persists even 6 months after the exposure. So it's not really just an adjustment or acute stress reactions. And there was difficulty with the challenges in implementing and validating screening tools for burnout and moral injury, which are two things I'll be talking about a bit, that are two syndromes that are present usually in healthcare workers in war settings. So I'll just present briefly. So the training in March 2022, and I'm just using the slides as I probably won't go over them, just as a reference for you guys. So and requested from Med Global a specific training for healthcare workers that would target trauma-informed care. And it would target non-specialized or non-mental health healthcare workers that don't have any mental health backgrounds. So it would be helping them managing their own emotions, managing burnout, but also in helping them, equipping them with skills to help them take care of patients that had been physically or mentally traumatized. And so we developed, in collaboration with Dr. Stephen Wine from UIT, over 6 months, 4 modules that could be given in 4 to 5 sessions. And they could really, the point of the module was, again, to give those approaches that would be an approach that would be evidence-based, that would be applicable to any setting, not just a mental health setting. So if you were in primary care, if you were in an ER and you had this patient, you could apply it. And most importantly, that would be targeted to non-mental health specialists, because that's really where the deficit is. So we developed these 4 modules, and I'll talk about them briefly. And these were the criteria we selected. So the first, and because we look at burnout as a systemic problem, not necessarily as a problem at the level of the institution, the first module targeted executives or leaders and managers, just anyone that was in a leadership position, to make sure that the system in place allows for burnout prevention, or for these modules to be implemented. And then the second and third modules are very interesting, because the second one would allow, so if I was a physician and I have no mental health background, and I'm worried about my colleagues, or particularly someone among my colleagues, and I feel like I need to approach them in a way, manage their burnout, they're showing up late, I need to discuss their mental health with them, but I don't know how to help them. This is the module that will teach you how to approach them, how to help them through their symptoms, and how to be able to create peer support groups if you wanted to. So we walk them through the steps of creating a peer support group and of having that difficult conversation. The third module is self-care for healthcare practitioners. Whether you're a nurse or a physician, if you're starting to burn out, what can you do in a war setting? Not in a burnout as an occupational hazard in a high resource setting. And then the last 2 modules are very interesting. So they're based on, and I'll go over what skills for psychological recovery is. The second 2 modules, the last 2 modules are, if I'm a physician and I get patients that necessarily need psychiatric help, in the sense that, so if you keep in mind the war setting, most people are not really walking around with a major severe mental illness, major depressive disorder, with PTSD. What they are mostly walking around with are subsyndrome symptoms. These are subthreshold syndromes that could be quite as impairing. So these could be some mild anxiety, some mild irritability, difficulty managing your emotions, difficulty with problem solving, difficulty prioritizing your needs. And these are, so we decided to go for an intervention that would be evidence informed, but that would help with these symptoms. So it's somewhat between, so it's not psychological first aid, because everyone was doing that, and mostly psychological first aid is implemented in the early settings and the aftermath, in the early period in the aftermath of a trauma. So it's not necessarily when there's an ongoing prolonged war, a year into the full-fledged war. And you want to be also to implement something that would not need clinical psychiatric intervention. So we're not making these healthcare workers psychiatrists and psychologists. And so we decided to go for something called Skills for Psychological Recovery. We translated it into Ukrainian because it wasn't present in Ukrainian. And basically, these are skills that have been proven to be protective against PTSD, to promote resilience, and to promote recovery. And they're somewhere in between a clinical intervention and psychological first aid. And it's evidence informed, and these are the different skills that we go through. So building problem solving skills, promoting positive activities, managing difficult emotions or reactions, promoting helpful thinking, and rebuilding a healthy social network. And as you can see, these are things we could all benefit from, but sometimes you lose sense of how you could make that happen when you're in when you're in crisis, or when you're going through rough times. And so the actual training and the module was very practical in that we went over exercises and applied them to different attendees, and it proved to be extremely helpful. Just to show you, just to get an idea, because people don't really have a sense of what we do in mental health trainings. And so, for example, this was a letter that was the exercise for skills for psychological recovery. So the attendees came on day 1, day 2, day 3, day 4. And then at the end of the training week, they gave us back the homework they had. And so someone, for example, wrote in under promoting positive thinking, some of the unuseful thoughts they were having. I often want some people to die. For example, an old lady that offered boys to rent a room for a high amount of money. Internally displaced people that get treatment in our children's hospital and say, I don't pity boys dying. That makes me furious. Thinking how you could replace that with promote thinking, and they really show you what people were going through. Soon the war will be over. I'll be the mother of the bride. Unfortunately, I mean, it's difficult to implement, but it's a good exercise to do with the patient themselves or with your colleagues. Another one was going through the social network support. So we build with the patient who their social network is and who they would be able to reach out to, whom they should be making more efforts with. So relationships that they've kind of let go of because of the war and the trauma. So these were the goals that they had put. I'm not going to go over them. This was a writing exercise they had done. Someone had written a letter to her friend and then sent it to her. If you want to read it. And then I'll just share briefly. I know we don't have a lot of time. Tell me how I'm doing on time. I'll share a bit, some testimonials. I'll go very briefly. This is one of the attendees. Can you guys see it?
Я є лікарем-педіатром та керівником відділення мобільний хоспіс для дітей. Так дуже корисно, тому що ми, як лікарі, повинні вміти поспівчувати як пацієнтам, так і їх сім'ям, тому що бувають дуже складні ситуації, в яких люди потребують розуміння та співчуття. Але також нам потрібно вміти дбати і про себе. Тому що є багато чинників, які впливають не тільки наша робота важка, але і зараз і в країні війна, що теж не минула нас, як лікарів, так і людей. Мені запам'яталось кілька таких речей, що стосуються, наприклад, що якщо людина має проблеми, то потрібно краще допомогти їй, щоб вона сама зрозуміла, як вирішити ці проблеми, а не поділяти цю проблему з цією людиною, не брати чужі проблеми на себе теж. Також мені сподобалось правило 5 хвилин, що, наприклад, що... Мене звати Левко Наталя, я є лікарем-педіатром та керівником відділення мобільних хоспіс дітям. Мене звати Василина Гранжа, трансплантації кісткового мозку у Східноукраїнському спеціалізованому дитячому медичному центрі. Я думаю, що тренінг буде дуже корисним, тому що у зв'язку з війною в Україні є надзвичайно велика кількість пацієнтів, які приїжджають і мають психологічні, можливо, якісь травми або психологічні страхи, які їм потрібно якось побороти. На жаль, на мою думку, в Україні не настільки сильно розвинена сфера психіатрії, щоб люди могли вільно звертатися до лікарів і говорити про свої проблеми. Тому, якщо кожен медичний працівник буде хоча б мати якесь невелике уявлення про те, як допомогти людині в її важкій ситуації, це буде краще, тому що люди не будуть боятися говорити про те, що їх болить, і як їм краще допомогти самим собі і отримати допомогу. Для мене було важливо пройти тренінг, тому що я спілкуюся з великою кількістю дітей, які мають онкологічні захворювання. Дуже часто ці захворювання.
I just saw the chat, sorry, so I'll move forward with this. Lessons learned, this is almost I think my last slide. So there was an increased alcohol use disorder. This is important. So when we asked the feedback of the attendees, they said they would want a module impaired had resorted to alcohol as a substance use more recently. So we're planning to add that. The lessons learned also is most states are subsyndromal. This is what we spoke about. Not everyone is walking around having a diagnosis, nor should they, but it doesn't mean that we don't intervene sooner. So that whatever they're going through doesn't develop into a diagnosis. I think we're planning to move forward with the train-the-trainer model. So we're going to train hopefully Ukrainian trainees, healthcare providers who will go on to train other providers because of the language barrier. Trainings to be culturally tailored is extremely important. It may not be standardized across all countries, including, for example, the alcohol use issue. We need to address, for example, in Ukraine, internally displaced physician as a different category of physicians, because these are going through a completely different experience than those that had stayed their entire life in Lviv and had not really suffered as they had suffered, but they were not as hard hit as those that had lived in the East and were internally displaced. And so if a lot of people ask me how the trainings go, most of those that took the training will go on hopefully to use the skills. So the pilot was successful. And I like this. I don't know if you have the time to go through it. What was the most important thing you need? You'll see that a lot of people focus mostly on self-care and peer support rather than patients. And what else would you like to learn? They would like to practice more. So we're removing some of the didactics and putting on a lot of more practical stuff. Thank you. I'm done. Sorry for the time delay. I just wanted to go through the videos as well.
Thank you so much for sharing that with us, Dr. Bisri. Next, I'd like to welcome our presenter, Dr. Kathleen Gallagher. Dr. Gallagher joined the Med Global Ukraine team in April following the invasion and has since completed 3 trips since the beginning of the war. These have focused on pre-hospital medical care and triage, as well as mass casualty training programs for several hospitals. She's a former Army combat medic and served overseas both in Iraq and Afghanistan. She is presently a 4th-year general surgery resident at Vanderbilt University Medical Center in Nashville, Tennessee. She hopes to continue working with Med Global for many years to come following the completion of her surgical training. Welcome, Dr. Gallagher.
Good morning, everybody. Let me share my slides real quick. All right, can everybody see and hear me?
Perfect.
All right, thank you for the introduction, Dr. Wild. I'm Kathleen, I'm from Nashville, Tennessee, and I'm here to talk about our efforts through Med Global to provide triage training and mass casualty training to our Ukrainian colleagues. Introductions have already been given. I'm a 4th-year general surgery resident at Vanderbilt, did several tours overseas as a combat medic, and have traveled to Ukraine with Med Global 3 times. And if I can convince my PD, there will be many more trips in the future. Nothing really to disclose with the exception of most of what I'm going to talk about was driven and designed by Dr. Judah Slavkovsky, who recently actually returned from Afghanistan safely after spending 6 months there, but he was a huge driver of this, of these missions in this program. So my goal is to kind of tell you about our training in 3 phases. As you can see sort of from my background and his and what we're talking about, our goal was to sort of help in that acute phase of the war, the beginning stages, as people were, for lack of a better word, becoming acclimated to conflict, and then kind of tell you how our mission has shifted along with the conflict into a more chronic phase. So the first stage, the first mission was back in April, so fairly early in the war, and our goal was and is always to provide triage and mass casualty training to our physician colleagues and then later our nursing colleagues in Lviv and the surrounding regions. I think it's important as we kind of go through this that, you know, the goal of any kind of humanitarian aid, peri-conflict or otherwise, is to help initially and then make yourself obsolete as you train the trainer. And I think we've successfully done that. And I hope you guys see that as we go through some of these slides. On the first mission, really it turned into more of a fact-finding and contact-making mission. We still did quite a bit of training, focused a lot on ATLS, trauma skills, teaching these very well-trained surgeons how to, unfortunately, apply their skills outside of the hospital, which was a very popular discussion, albeit an unfortunate one. But we learned a lot that first mission. The first was that our Ukrainian colleagues are exceptionally well trained. They do not need us to come in and tell them how to be surgeons, doctors, nurses, anything like that. What they needed, and the need we identified, was that they needed some help maintaining their civilian operations. So we worked with large regional hospitals, trauma centers, adult and pediatric in Lviv, who were already taking care of a large number of patients. And they needed some help shifting over to more of a combat footing, where they would then be able to flex up and care for an incredibly large number of combat casualties, in addition to maintaining their daily operations. We also learned, and I don't think this surprised anyone, but they're incredibly brave folks who all had, I think, the means to leave, but everybody chose to stay and continue to take care of their patients and support their country. So it was an incredibly humbling set of interactions. This also, I think I put these two pictures up just to demonstrate. On the screen left is a mural that was put up in one of the regional hospitals by some of the locals as a thank you to the nurses, doctors, and staff after the COVID pandemic. So they were reeling, like we all were, from multiple bouts of COVID. But then where we were able to settle out and sort of return to normal, they were then forced to sandbag their windows and prepare for a war. So our mission, as we saw, was to take a very well-developed healthcare system and unfortunately teach them to be medical combatants. The second mission was in May, I think 5 weeks later is when we returned. And this, in my mind, was sort of where we hit our stride as a team and a set of teachers. The goal, again, remained the same. Our focus was triage and mass casualty training. And we tweaked our methodology just a little bit the second time, and one, narrowed our focus specifically to triage and mass cal, and two, we sort of narrowed our targets. We worked with 3 large regional hospitals, again in Lviv, all of whom we had worked with previously, so we had contacts on the ground. We spent 2 to 3 days at each location instead of 12 to 24 hours. We did some didactic, but our goal was to really get to know them, get to know their individual hospital and its needs. We did extended walkthroughs, usually on the second day, and walked them through creating a mass casualty plan. Where do we put patients? What are the resources they can bring to bear? And how do they move people effectively through the spaces that they already had? And then usually the second afternoon or the third morning was our mass casualty drill, where we essentially walked them through a couple scenarios and then used medical students from Lviv, actually, who volunteered to be patients, and just really hit them hard with casualties and put them through the paces. And uniformly, they did a fantastic job. It was really inspiring to see. These are just some pictures from, this is one of the government hospitals that was taking care of both civilian and military casualties. And these folks really dove in. You can see, again, on screen, right, Judah is working with some of our interpreters. The 2 individuals in the foreground are some of our medical student leaders who organized a large number of their colleagues to come and help, both act as patients and service translators. Again, these are just some more pictures from that day. One of the really cool parts about this experience was the hospital that we went to following this experience had already heard about the training that we were going to give. They heard from their colleagues and their friends, and that it had been useful and helpful, and they were really excited to participate and had already prepared some things in advance. So just an incredible group of people. And then, as the mission, as the conflict evolves, how do we change? How do we adapt and continue to be helpful? And this is the mission that I am far and away most proud of for several reasons. We had, in discussions with a lot of the Ukrainian surgeons, had talked about how do we provide a stable source of the triage officers, i.e. the person who's standing at the door sending casualties into their different triage categories. And traditionally, that's the most experienced surgeon in the group, just making quick decisions and sending people. But surgeons are in really high demand, as are all physicians and nurses over there right now. But we had suggested several times that they train some of their more experienced trauma nurses to do that. Had gotten some decent pushback, just I think based on some interprofessional dynamics, but some of the physicians and nurses that we had worked with on missions 1 and 2 got in touch with the Ministry of Health and then reached out to us and said, hey, we want to do this same training for nurses. We're going to pull a bunch of folks off the front and some people from Lviv, and we want to A, plan it, and B, execute the training. And we just want you guys there as support, which was just exactly what you want to see. And they executed it darn near flawlessly. So the same goal there. What happened is they pulled 150 nurses from the surrounding region and from the front, trained them extensively in that triage officer role so that they could then step in and free up the surgeons to operate. They also did mass casualty management, and then several other organizations partnered and they did stop the bleed training, mental health training, a number of other information sessions in this conference that were, I think, really well received and very useful. And again, just to reemphasize that this was entirely planned by our Ukrainian counterparts and just supported by us, which was really quite special. This is a picture of the mass casualty event that they put on. These are all, everyone in uniform is a Ukrainian first responder that volunteered to come help. They did a really, regardless of the setting, a really high fidelity simulation and showed the nurses what they were capable of and what they would be faced with in this situation. To draw your attention to, I think, one of the more special pictures in screen upper right is they have first responders for mental health in these mass casualty situations. And their job is to go around and talk through at point of trauma these patients and start that triage process early, which I think anytime you have the opportunity to take a lesson back home, we should. And this was one of the ones that I brought back home. And I think we should reemphasize point of injury mental health care here in the States as well. Another point, just to highlight how brave and wonderful these folks are. This is our training was unfortunately interrupted on day 2 by several incoming rounds. And we initially went to the bomb shelters, and it was about 5 minutes in before somebody came from the other bomb shelter and said, hey, they want to keep training. We're going to bring folks over. And so we just kept rolling. And I, again, would just love to emphasize their commitment to cause and bravery and professionalism. So it was a true honor and a pleasure to work with these folks. And from what I have heard, they are going to continue to put on conferences out in their regions and extend this training as we had hoped from the get-go. Before I close out, would just love to make a plug. Our biggest supporters, other than the Ministry of Health and the physicians themselves, were our Ukrainian medical students. We had about 20 of them who worked tirelessly, were volunteers, supported us, worked as translators, and then in their free time showed us their amazing city. And so in your organizations, both here and abroad, if you have the opportunity to support these folks, I think primarily by organizing observerships so that they can get medical training, despite the fact that theirs has been completely halted. That's probably the best way that you can help these folks. And I'll share my email address if you guys have any questions. We have a couple initiatives to that effect. But I would say overall, we're really proud of the work that we did over there. We're even more proud of the work that our Ukrainian physicians and nurses did. We are thrilled that they're continuing that. And then our next steps, sort of from a surgical and acute care perspective, are there's a course in the States that we give called ASSET, and it's essentially surgical exposure and trauma and how to quickly provide damage control surgery. And Dr. Judah, Dr. Sematoka, and I are working on continuing those classes. They've already given 2, and we plan on giving several more this year. So lots of exciting stuff in the future. And thank you all for having me.
Thank you so much for sharing that, Dr. Gallagher, and particularly for highlighting the role of medical trainees. Our final speaker I'd like to introduce is Dr. Tanya Busyrka, who is a very proud second-generation Ukrainian American and an emergency medicine physician in Eugene, Oregon. She has been on 5 mission trips with Med Global since Russia's invasion. She teaches point of care ultrasound to frontline medics and doctors, and she has many family members in Ukraine and is extremely passionate about her work. Welcome, Dr. Bucierka.
Thank you for the introduction. I'm very excited to be here talking about my mission trips to Ukraine. I just returned from my 5th mission trip about 2 days ago. And I've crossed paths with Kathleen on our mission trips, and it's an honor to be here to talk alongside her. So my role within Med Global has been teaching point of care ultrasound. Sorry. So just to go back to what Alexandra talked about, so within all of our trainings in Ukraine, we have performed 79 trainings. That's between basic life support, stop the bleed, point of care ultrasound, chemical weapons training, triaging, how to triage patients, and our surgical skills. So we have trained over 1,400 doctors and nurses from 108 different hospitals within Ukraine. And then as an organization, we have donated more than $6.4 million of medications and equipment. So for those of you who are not familiar with point of care ultrasound, this was a team of 4 that we just came back with. We were in Rivne main hospital, and we are all ultrasound. We're emergency medicine doctors that use ultrasound on a daily basis. So what it is it's a portable ultrasound device that we see up there, the probe that can plug into an iPad, an iPhone, any Android device. And this is what doctors and nurses or anybody or medics can use on the front lines to detect life-threatening injuries. They can detect bleeding or blood around the heart, free fluid in the abdomen, a collapsed lung. And a lot of times this is something that they can intervene on. This is something that they can act on quickly and determine whether a person can go to a stabilization point or they can be shipped out further to a hospital. So our main goal with these trainings is to train frontline doctors and medics on these super portable devices. So this is just an idea. So what we've been doing on these missions is we hold 2-day ultrasound courses. Day 1, as you can see here, we go through the physics of ultrasound, knobs and presets. We go through the FAST exam. We do a cardiac ultrasound, lung ultrasound, and then we put it all together. Our second day is very similar. We look at deep vein thromboses, aorta injuries, soft tissue injuries, nerve blocks, gallbladder, small bowel obstruction, and then we put it all together. So these classes are truly a 1-hour lecture, 1-hour hands-on, and we do that for 2 days. I have been a part of this. We've been going from the West. We started in Lviv, we moved to Ternopil, we went to Kyiv, and just now we went to Rivne. We're looking to move farther east to continue our trainings. And as far as the healthcare system in Ukraine, typically one hospital has an ultrasonographer. They don't have people that can do this all the time. So we are equipping them with what they need to help save lives on the front line. So this is an example we always have. So this is Kevin Z, a fellow from the University of Florida, giving one of our lectures on blast injury this past week. And then we go ahead and practice on that after. We identify those that are going to the front lines and that are working at stabilization points that can use the ultrasounds. And then they ultimately, we're training the trainer and they're training all those in their brigade around them how to use point of care ultrasound. This is just hands-on, just to give you an idea. It's a super portable device that you can look at the heart, look at lots of different internal organs, and quickly identify life-threatening injuries. Also, in the mission trip that I just came back from, we had 2 wonderful nurses with us, Alicia Bean and Meryl Tidings. They taught Stop the Bleed as well as BLS training, which this is the Stop the Bleed training. And so it was very eye-opening because a lot of the doctors and a lot of the nurses that we were training on point of care ultrasound as well as on Stop the Bleed are not always military people that are, called to the front lines. These are civilian doctors that are pediatricians, cardiologists that haven't taken a BLS or Stop the Bleed course in so long. And they're just so thankful and so resilient and willing to learn and willing to teach others. It's it's been quite a rewarding experience. This is the group of 4. So we did a week-long training in Rivne, and then we moved on to Lviv, where we did a training alongside with the Ukraine Polka Society and Razom. These are just all the instructors that we had. We couldn't post any pictures because we trained 20 frontline medics and physicians that cannot have their pictures taken, but we were able to give every one of our participants a butterfly ultrasound. We provide them with resources. We come up with WhatsApp chat groups to stay in contact with them, to continue helping them and to continue helping them learn. So that's all I have on my presentation. I wanted to shorten it just a bit so that we could have time for some questions.
Thank you so much, Dr. Bucierka. Really appreciate you sharing your experience. It looks like we have one remaining question in the Q&A from a participant, Sam Friedman, who is wondering about the scope of spread of, I believe he's alluding to, infectious disease under wartime conditions, acknowledging that he works virtually with people from the Ukrainian Alliance for Public Health. Do any of our speakers have any experience that could pertain to Sam's question? If not, we'll work with our network to try and get an answer to you post webinar. Do any of our panelists have any questions for each other in conclusion? I do have one, which is how particularly some of our US-based physicians or colleagues prepare for such deployments in terms of briefing themselves on a security or political situation, if that's something that's led primarily by MedGlobal or something that individuals take personal initiative to conduct.
Dr. Wild, I can speak to that just a little bit, and that, like everything else, has evolved with each MedGlobal mission. The first one I went on, I was the one that gave the security brief, which was, that's not my area of expertise, but they have started to work with folks on the ground. There are a couple security contractors on the ground. Our third mission, we have somebody that walked around with us, had contact with some intelligence. We was able to gather some intelligence and move us around safely. In preparation for this, I would say, it's super important to be familiar with the kinetic activity in the region. We have a couple really good resources for that. And it's also important, I think, if you haven't before, it's really important to learn how to exist and move and work in an environment where anything could really happen. And I have a couple of resources for that. I'd be happy to send you, and I'd be happy to share our sort of de-identified pre-security brief as well. I also think that there's like an emotional mental component to it as well. And I've talked to Dr. Sulhul about this quite a bit, but it's not ideal to just go from the States to that situation in 12, 24 hours. If there's an opportunity to take 48 hours to kind of settle in and prepare your mind for what you're about to experience, I would very highly advise that.
Thank you so much for addressing that question. We have a couple others trickling in. One from a participant, Katie, asking whether anyone can comment on specific needs related to women's health, particularly in response to either reproductive health and/or sexual violence and conflict.
I can comment a little bit about this. If we speak about women's health, and government provides medical services for pregnancy and also for all the women and also for IDPs. And in Ukraine, we have like declarations with family doctors and also with women doctors, with gynecologists. And now, and we need to go to these doctors that with whom we have this declaration. And from the beginning of the war, Ministry of Health led to go to any doctor where you are. If you are IDP, you don't need to sign another declaration. It is very simple. If you need access to women to these doctors, you just can come to the hospital, to the primary health care department, and they will provide help. And also, if we speak about about sexual violences. I think that you know that there were at the beginning of the war, especially at the occupied territories, there were a lot of cases of sexual violences, and also there is a program in Ukraine under First Lady Olena Zelenska. It's like mental health program, like hotline, where these people who suffered from sexual violence could call anonymously and to receive some psychological support, and also they could complain about this crime anonymously. And also, thanks to our donors, international donors, they helped us with special medications for these people that suffered from sexual violences. And what I would like to say that Ukrainian government tries to help more in two ways. It's like psychological support and also physical medical aid for these people who suffered from sexual violence. Thank you.
Thank you so much, Alexandra. We're nearing the end of time. I would like to triage one last question from the group from participant Steffi Ward, who is a student mental health nurse in the UK, who wondered what the long-term impact on the role of nurses in Ukraine might be moving forward, and as well as how conflict has changed this landscape. So with an eye to time, if one of our participants could either quickly address that question or follow up with Steffi directly, that'd be lovely.
A quick answer to your question. I think historically, it does not sound like nurses have gotten the respect that they deserve. And I think if there is anything positive that comes out of a conflict like this, I think this is an opportunity for the Ukrainian nurses to show exactly what they can do. And I think there's such an incredible part of the medical effort and the war effort that I think they will be a much more I think they will be an incredibly integral part of the healthcare system going forward, and they're gaining the respect of their physician colleagues rapidly.
Thank you so much, Kathleen. In conclusion, today we had the opportunity to hear about a wide range of issues from our speakers. First, a broad overview of MedGlobal's response operations in Ukraine. Subsequently, about a package of mental health interventions for healthcare workers practicing in conflict. From Dr. Gallagher on trainings focused on triage and mass casualty, as well as impressive, successful task shifting to nursing and passing essentially these on to Ukrainian partners. And finally, from Dr. Bucierka about ultrasound training, but a wide range. The recording of this session, along with additional materials, will be shared. Steph has kindly posted the link to where you'll be able to find those in the Q&A. Given the limited time that we have, we'll try to address any outstanding questions in writing. Pardon, and please feel free to use the link that I just shared to submit further questions to us after the event. Thank you so much to all attendees for your participation, to our panelists for sharing your experiences, as well as the Alliance for making this event possible. Please reach out to us via the Alliance website. We'd love to hear from you. And with that, we'll close the session, barring any further comments from Dr. Hagopian. All right, thank you all.